people's posture all day long, one of the key measurements we take is a leg length inequality measurement. And so many times people will watch how we're doing it and they'll see that there's all these steps to it, or there's a sequence of events that are happening. And the reason for that is because it has to be done in a very sequential and orderly manner to be able to get a very accurate measurement. So when it comes to the question of, does somebody have a short leg or not, the answer to that is there's actually two types of short legs. There's actually a structural short leg where if somebody broke their tibia or their femur and it didn't heal properly, they may actually have bones that are shorter on one side of their body than the other. I've seen patients over the years that grew up with polio who are one side of their body developed different than the other, and they also have a short leg. So there can be such a thing as a structural short leg, but the majority of people who have a short leg, it's not structural, it's what we call a functional short leg. A functional short leg is a problem that's exhibited within the patient's body that's really more of a neurological problem that stems from the base of the skull. So there's a problem up at the base of the skull with the brain stem and the reticular activating system causing one side of the body to contract tighter. When it pulls tighter, it draws up the hip and makes the leg appear short. That's what we reference when we're talking about a short leg. It's actually a leg length inequality measurement looking for a functional short leg that we're taking. Now, how long does it take to get good at doing that? Well, my experience has been in training a lot of doctors, not only through the NUCCA conferences and the seminars that we host, but also just training doctors in my own clinic, is taking leg length measurements consistently is not an easy thing. It's actually a very specific skill set to develop. And I found that it can often take 6 months, a year, before you can actually train somebody to do it very, very consistently, where you could put 5 doctors in a room, have them all measure the same patient, and all the doctors are coming up with the exact same short leg and the exact same amount of deviation, whether it was a 1/4 inch or 3/8 or whatever it was. And we've seen this to actually be reproducible again and again, actually in research studies. The Upper Cervical Research Foundation and NUCCA did a leg length inequality measurement study where multiple doctors measured patients to see, okay, well, did they find the same thing? Was it consistent? And the answer to it is yes. It was a pilot study, and we're looking to do a larger one where there's more doctors and more patients engaged. But the answer to the question is yes, you can do an accurate leg length measurement, but there's a series of steps that are part of it, and it's usually a process to train a doctor to become effective, efficient, and accurate in doing so. And so the answer to the question of does someone have a short leg or not is it depends. Is it functional or is it structural? And when trying to determine how much is it, then we have to work on the consistency of the practitioner and their skill set to determine whether or not they can do it repeatably and consistently.